First, I'm Munir Iman, Assistant Vice President, Real Estate Consulting at Callan LLC, an investment consulting firm, and I will be your moderator and speaker. We have a very talented, bright pair of guests that are with us today, Tsegga Seyoum Medhin, an equity accelerator. First, we have Sara Imam. Sara Imam is currently a third-year medical student at Loyola University, Chicago's Stritch School of Medicine, located in Maywood, Illinois. Sara, thank you for joining us.
Hi, thank you, Munir, for inviting me. I feel honored, and salam to everyone that has joined in.
Great. And can you give us an update on the general state of COVID-19 in the U.S.?
Yeah, definitely. So as of last night, according to the CDC, there are approximately 895,766 cases of COVID in the U.S., so nearly 900,000. And at the moment, there is just a little bit over 50,000 deaths due to COVID. So that gives us at about 5.6% mortality rate. And of course, the states that are most affected include New York, New Jersey, Massachusetts. And then the fourth right now is where I'm at currently in Illinois. So that's where we're at in the U.S.
And how's that been for you with your clinical rotations in the hospitals? What's been your experience with COVID?
A great question. So for a lot of students right now on all levels, starting from elementary up into graduate level, all in-person classes have been canceled beginning mid-March. So a lot of us are currently attending what we now call Zoom School of Medicine or Zoom University because a lot of our classes are now occurring through these Zoom sessions online. And so for myself specifically as a third-year medical student, your first 2 years are spent mostly in the classroom learning the material with some clinical experience, but your third and fourth year, you are specifically in the hospital and clinical settings, developing your clinical skills, interacting with patients, interpreting labs, all of the hands-on stuff you think of what a doctor does. So when COVID started getting more serious in the U.S. around mid-March, all our clinical rotations came to like a strong halt. So it was like a Monday morning, we got an email at 9 a.m. that all clinical responsibilities need to be stopped immediately. All students have to be dismissed immediately. And they did that mostly to protect us from possible infection and exposure, but also to preserve PPE and protect our patients as well.
And so when you were working during your clinical labs or when you're in the actual hospital, how did that go? Because at least from my perspective, you see on the news, but when you're actually in a hospital, how did that go from hearing it to the shutdown where they pulled you out of school?
Yeah, great question. So for me, I was on my internal medicine rotation, and internal medicine is basically what you think of what a hospital doctor is. They're called hospitalists, some of them who are maintained in the hospital. So during our actually first day of orientation, our clerkship director mentioned, okay, COVID is a concern of ours. However, we don't have any patients as of now at Loyola Hospital. But as the week went on, we kept hearing more and more as students and rumors about patients coming in, residents getting exposed, all these things. And I know there was a sense of a little bit of fear among students. And even with our fourth years, during your fourth years when you apply for residency, whichever specialty you decide to go into, and the biggest day that people look forward to during their fourth year is called Match Day. So that's where they find out where they're going to be spending the next 3 to 6 years for residency, whether it be pediatrics, surgery, all those things. That Match Day, they got an email that week that it was canceled due to basically lawmakers saying that they want to limit large gatherings. And Match Day, there's people flying in from all over the country, all these things. So you could already see administration was making moves to limit large gatherings. And so we were just waiting around to see when it would affect our clinical learning experience. Mm-hmm. So I know with my team specifically, there was a little bit of fear and worry just with potential exposure and whatnot. But then the administration made the call to stop all clinical responsibilities for students just because to limit exposure, and also it would also be a disservice to us because then these physicians couldn't even properly teach us the material when they're trying to treat patients during these demanding times.
Mm-hmm. And so for fourth years, that's a pretty big transition, correct, when they figure out where they're doing residency?
Yeah, so by your third year, you're going through different rotations to figure out what field you're interested in. So you'll do a couple of weeks like in OB-GYN, a couple of weeks in pediatrics, internal medicine, surgery, psychiatry, kind of the bread and butter of medicine. By your fourth year, you've kind of decided what you're going into. And so you begin applying for residency at the beginning of your fourth year. And what we're seeing a lot of also, like with places that have been hit hard, like New York, is that there has been a push for medical students fourth years, particularly to graduate early and to staff the front lines because of the massive, basically the hospital systems are overwhelmed and they need as much help as possible. But then there's been also a lot of controversy around that because many people feel, one, it's kind of a disservice to have medical students that are just graduating come on and start and serve in the front lines because they haven't had that full experience, that full autonomy that you kind of gain during the first couple months of residency, whether they be thrown in and there wouldn't be as much oversight as there would be in like a normal transition to residency where an attending can really groom a resident into developing their skills and being confident in their leadership and like taking care of patients. Then again, it's also, we're in a pandemic. No one has ever experienced this before. No one knows what's going on. We're learning about this virus every single day. So many people view it as we can take the help that we can get at this moment. By your fourth year, you pretty much know how a hospital runs. You know how it operates. So you could help out in that sense too. So it's been interesting.
Then how does that feel as a third year, seeing that transition for fourth years?
Good question. A lot of us third-year medical students are very anxious about what the next year is to come, as is many people in the U.S. Like, we don't really know what the future looks like. For us, though, as watching this from the sidelines and seeing how this virus has kind of impacted the healthcare community, it's kind of made us realize it's a positive in the sense that we can see what it looks like to have a role in a crisis in the healthcare setting. Like, we won't have the luxury of being able to work from home, rather like we have to step up and answer to this call, and this is what we've dedicated our lives to. At the same time, in our position right now, there's a lot of anxiety in the sense of planning our future because now that our clinical rotations are on hold, we don't know when we can go back into the hospitals. We don't know when if we'll have time to make up the time lost in these rotations that have stopped. And then additionally, we don't know how residency applications will work as well. A lot of people are talking about, so the way residency works is you apply to a bunch of programs and you fly out to hospitals and you interview and you're touring the hospitals, you're meeting the other residents. There's been a lot of rumors about doing virtual interviews, which is good in the sense that you're protecting the other hospital systems from potential exposure, but it's also a disservice to us because we don't get to view the hospital setting. We don't get to see how the residents are working because residencies, like the main years, we're kind of establishing your career and your skill set. So you want to make sure that you end up in a place that's going to groom you into the physician that you want to become. That's kind of hard to do if you're doing a Zoom interview. So it's a lot of anxiety. But then I feel like this is a universal feeling in all career aspects because, again, we don't know what the future holds. We don't know when the stay-at-home orders are going to end. We don't know when businesses are going to open up again. So a lot of unknowns, but there's also some comfort in that because we're all in the same place because, again, we're learning about this virus every single day.
So you're at this big inflection point of whether the future of schooling and, even your own immediate transition for your year. And so I guess, have they told you how they expect class to continue, or are you still kind of in a holding pattern?
As of now, I'm still in online classes through Zoom. My exam is scheduled at the regular time. Now they have us doing exams at home, but they proctor them through Zoom so they could see our computer screens and whatnot. However, in terms of going back into the hospital and getting that clinical experience with your resident and attending, as of now, they predict that we could get back into rotations on July 6th, but that decision is also pending. So that's another 2 months of kind of studying at home. And I know, talking to many medical students from various institutions, there's a lot of worry in terms of maintaining the mental health aspects in terms of trying to study at home and manage with the anxiety of not knowing what's going to happen, and also the timeline-wise, how things are going to work out for us. But at the same time, it's like we can only do so much from our position. We just have to wait and see how the virus progresses.
And so how are you managing amidst all this, I guess, uncertainty?
For me, I'm managing okay. You know, I'm in contact with my family. They're my rock, you know. I keep up with them, my faith as well. And I'm, speaking to other medical students, expressing our concerns is kind of a good outlet for us too. For me, in my perspective, it's just that this is kind of above me. This is above us in terms of what is going on, and there's only so much we can do on our end. So we just have to hope and pray for the best, that the virus kind of slows down and people start getting healthy again, and people also follow the rules by staying at home, with the stay-at-home orders, maintaining social distancing, sanitizing and all this stuff. And it's also interesting to think about like the future of this and how our society will function in terms of overcoming this pandemic, and also just basic social interactions. So
that's great. So you're focusing on what you can control and relying on your loved ones in this moment of uncertainty.
Yeah. Definitely.
Well, thank you, Sarah. I really appreciate you sharing experience with us today.
Yeah, no problem.
So for individual and small business owners, there are many benefits available that you must determine if you're eligible for and if you can apply for. And it's important to remember that these are your tax dollars. This is not a handout. This is the system you've paid into, whether it be sales tax, property tax, income taxes, and these are your dollars you've been paying to the government. And through no fault of your own, a 100-year virus has caused an economic disruption. We are forced to stay home, unable to conduct our respective jobs, businesses, to prevent the spread of COVID-19. So the CARES Act, a $2 trillion stimulus package, was passed, and a large part of that are the individual stimulus checks, which some have received and many are still waiting for. You can go to irs.gov to determine when they have been issued and when to expect them. And there's an additional provision for non-tax return filers. This is particularly important for college students if you've not been classified as a dependent by your parents, and also for senior citizens. If you're not required to file tax return, you could be eligible for a stimulus check. So I encourage you to check online at irs.gov. And separately, many members of our community are small business owners, particularly restaurant owners, and there's funding available through the Paycheck Protection Program. It was originally $350 billion, and it ran out 2 weeks because of all the demand, all the disruption that businesses are facing. And as of yesterday, additional funding was passed. So they've added $321 billion for the Paycheck Protection Program, and they call it PPP, and that will become available come Monday, 10:30 Eastern. And details still remain murky, so I implore you to speak with your local business representative, banking professional, personal finance consultant, as loans are being processed on a first-come, first basis. So it's paramount that you have your paperwork prepared in anticipation. And just to reiterate, these benefits are available to you, are yours. This is money you've been paying into the system, and that through no fault of your own, due to this unique black swan event, the whole world and economy has gone on pause. And so if you're eligible for unemployment, disability, or paid family leave benefits, you should check www.labor.ca.gov for more information. Additionally, another great resource is whileathome.org, a website that aggregates resources, breaking it down by state on everything from COVID-19 testing to, if you're more fortunate, to donating to relief funds and even to employment opportunities. All the links that have been mentioned will be available on the YouTube recording of this discussion. And now for our guest speaker, Tsegga Medhin. She's the founder of the Pearl Leadership Institute, an organization focused on transforming women, girls, and economies forward faster. Tsegga is also a speaker, consultant on corporate social responsibility, social innovation, and impact investing. She serves as the president of the UN Women USA North Carolina chapter and a U.S. Presidential Volunteer Gold Award recipient from President Obama and President Bush. Tsegga, thank you for joining us today. Tsegga?
Yeah, well, thank you. Thank you, Munir, and thank you, everybody. I think what I'd like to do first, actually, is obviously to thank you all for inviting me, Dr. Mangus, for creating the Changemaker Knowledge Platform. I thank Munir for facilitating this intergenerational conversation. And Sara, wow, I'm so inspired and grateful for your service, and to that of all our local and global healthcare professionals and the essential workers for their selfless act of kindness and service. I know we don't get to see them much, but I'm sure you will take the message for us. I also would like to remind us about my heart goes out to the many friends and family we lost due to these health challenges and in an unprecedented moment in history. I'd like to say may they all rest in peace. And if I could have just a moment of reflection for just a second, if that is possible, if we just could pause for a minute to really realize how many we lost and how many are not well. So allow me to have just maybe 30 seconds worth of reflection. Thank you.
Thank you, Tsegga, for that very kind and moving words.
Thank you.
And for many of us, this is our first global crisis. Many of us were in school or younger when the recession occurred in 2008. And so there's no real anchor of experience to lean on when you hear all this everyday news of deaths and infection rates increasing while financial markets are experiencing extreme volatility, and we are constantly inundated with information. Then how do we make sense of a world like this, and how do we operate?
Thank you. That's a great question, obviously. I think it's one of the ones that none of us has any perspective. There's no prior, obviously. And so despite the fact there are so many stories, but in different times, in different ways of handling life and business. But I do believe, obviously, like any other studies where they, in a moment of VUCA, obviously, volatility, uncertainty, complexity, ambiguity, what we have right now is, in the words of one of my favorite books that I read is Dr. David Jeremiah, Seeing Past the Pain of the Present. There's a bend in the road which seems to be endless, uncertain, and also ambiguous. And then at the end, we understand through this book, at least for me, I seem to understand more that we are asked to summon up our courage to see the light, because there's definitely a light. And in essence, in this pandemic, we are also experiencing, there is also a lot of infodemic, so much noise, so much expertise or non-expertise or different things, including something coming from leadership that we have right now. So we keep on hearing all these noises. And so what I'd like to do for a minute is to understand that this is a time for us to pause. And I do, one of my other roles that I play is I coach some clients. And when I ask them, when I do coach them, and I ask them, can we helping them to break through the barriers and the limiting beliefs, I ask them a simple question. Given all this information you have now, how much of it matters to you so that it helps you pass the present pain? So that's a question that we all need to ask and say, okay, we know so much. We know all the information that we have coming from various types of sources. But then again, the answer should be as simple, because life is about a choice architecture and our consequential leadership and a lot of intellectual humility, because there's what we don't know, we don't know. So there's definitely a need for some kind of intellectual humility for us, because otherwise what will happen to all of us that we will choose to be in three zones. It could be the fear zone, where we are all scared and really not understanding what's going on and then becoming in a panic mode. We could also be in a learning zone, where we will understand what's going on, take whatever is important and drop whatever is not necessary. Or maybe we could be in the growth zone, where we would be able to grow out of this to become something and somebody. And then maybe out of that one, make a decision tree, where we'll have a way for us to know. We do decision trees at work, in our projects, and anywhere. But the most important thing that I think Sara mentioned earlier was to make sure that she's leaning into a grounded hope, which is faith and family. And then grounded hope, in essence, is that we don't bounce back, but we bounce forward toward recovery and rebuilding. So there's a lot of information, as I said, and we have to have a grounded faith or hope, because we have to get some clarity for our own person, so that we get to be brave enough to look at the reality head on instead of painting a smiley face. We're not really in La La Land, but we do understand what's going on. But what do we do with this moment? So we should start asking, given what's happened to me, what am I going to do about this? Or how can I build a better life on top of it? And then we start setting a goal for ourselves and maybe find resources of motivation to pursue some of these goals that perhaps they might help us to move forward. I'd like to suggest a book, for example, here for some of our listeners. That one of the books that I have been reading as well is a book by Angela Duckworth, which is Grit and Persistence. Because having grit is exactly what's going to move us forward. And so to construct a future goal. So that's what I would say for this. I don't know if does it make any sense?
No, that's a beautiful. I especially like when you said, is the info necessary to pass the pain of the present? Because you're right, we're more plugged in than ever. We see all these facts and figures. You can see a real-time update. You can go to websites and see how infection rates are spreading and all this.
Yeah.
And that, I think we need to remind ourselves, because we're constantly, whether it's our phones, computers at work, we're just in this information feedback loop. And I liked how you said about centering yourself and trying to move forward with growth by setting focus and goals.
Yeah. Thank you. Yes.
Yeah. And so at a time like this, how do you find similarly like-minded people who are in this stage? Because people are in different aspects, right? Some people may be, they've been trying to survive, and others may have an opportunity where they're more fortunate, whether that's to be able to work from home or they're okay in this time. And so how can people come together to create and add value together?
Okay. I think a few days ago, you and I had a conversation to understand exactly what this, the outcome of what is it that you were trying to do. So obviously, one of the questions that I asked you, which really surprised me, I was pleasantly surprised, let me put it that way. I said, how are you, Munir? And she said, all my needs are met. I'm okay. That is so humble. That is such an amazing story. Amazing response from a young man like you, where in essence we definitely think that there is so much upheaval, so much information. Yet again, you said, my needs are met. And that tells me a lot about you as a person. So in essence is that if I had to be your neighbor, if I had to be friend, I would be very, very grateful that I am your neighbor or that I'm your friend, because I know you have that calming effect that says, okay, nothing is broken, we're going to be fine kind of thing, right?
Yeah.
And so, so that's the thing. But then we'll have to and continue to come together with a lot of intellectual humility. And by that I mean what we don't know, we don't know. And it is a lot of information. We have to come also with a sense of hubris. We don't have to have no hubris like the one we have lately. Many of the so-called leaders do not seem to have any sense of emotional intelligence that is necessary to calm down not only their families, but also their nation. So that's where we are. So to move past the pain of the present, to add and create value, we have to make the choice of moving from being a think tank to a do tank. Now, this is a way for me to say, okay, there's so much think tank. There are so many experts that are saying what they're saying. We can name names like all the amazing resources that Dr. Menges has brought to the community is amazing. Now, we also have to have an opportunity to say, okay, we've been given all this information. What do we do with it? How do we come back? And so moving from that think tank to do tank, what are the things that we need to do? Social distance does not mean socially disconnected. But again, it's also not time to hide. How you mentioned earlier, IoT, the Internet of Things, now has become IOL, which is the Internet of Life. Everybody is a human being. As a human being, we need to connect back, because that connectivity is the one that keeps us as a lifeline, as a golden way of continuing to live the way we need to live. But more so, I also believe that the planet needs the collective creativity of change makers like you and the many that are on this call. So through the Pearl Leadership Institute, which is our organization, and my work on the UN Women SDG 2030, Sustainable Development Goal Plan 2030, we have a lot of work to do. Yes, it's a moment in time. No, I don't think I'm in a la-la land. I'm trying to be much more pragmatic than I need to be. And so there is the decade of action. This is so-called, if it had not been for this challenge that we have, the crisis that we have, obviously still this is a decade of action. By 2030, the goal of eradicating poverty and the risk of climate change are still waiting for smart people like you on this call. There are solutions to be made, decisions to be taken. I'm so amazed. My daughter has left a dog for me here, and so every morning I get up and I get to see that the sky is so blue. It's amazingly blue. Obviously, Carolina is known for having blue skies, but I can see it vividly to really have enjoyed this moment in time. So we have to come together to help fight and advocate for others against the systemic inequities that are now being shown in stark relief for everyone to see. The price that's been paid for those who don't have adequate access to health care, food, safe shelter, endless wars, human rights activism, violence against humanity. In your space, financial instability is unimaginable to all of us, especially within the marginalized communities of brown and black people, locally as well as globally. So I do believe that we will add value by looking for ways to better our best. We'll come back again by living purposefully, by leveling up to experience our quantum power, and then obviously to ignite our sustainable fire on all cylinders. And yes, it's hard, but I do believe you and I can do it. All of us on this call can do it. The whole world can do it. The whole United States can do it. The whole world, the whole planet is waiting for something like that. So I would like us to think in a very positive manner, because that's the way that's going to get out of this dark moment in time.
Yeah, there was a lot there as far as thinking globally and things that we can do, and to be, as you said, from think tanks to do tanks. And you touched on a few items that I want to dig a little bit deeper on. You talked about your work with the UN and 2030 goal. Can you talk about which items you're working on?
Okay. All right. So through the in 2015, I was invited by the UN to come and talk about women's role in the right after obviously by 2015 there was the Millennium Goals. So that was done, and so the 2015 they wanted to have another 15-year kind of strategy that really helped the world, 174 nations, to make sure that everybody's on the same path to eradicate poverty. And obviously the biggest elephant in the room in the planet is climate change. So those were the two main things. And on each one of them had there's an underlying current of having the role of women, the eradication of poverty. If women are obviously in a space where they will have not only equality but equity, earning the same amount of money for the same kind of work, there are lots of studies, including McKinsey's 2019, that said this is a $23 trillion economic growth for the whole world. Now, if we're thinking, if companies are serious about what they're saying, if they're putting, if they're walking the walk and they're talking the talk, obviously, $23 trillion is not a small amount of money. And if that is going to be achieved by having a women empowerment, definitely that's what we need to do. So it's not a kind and cool thing to do to have women empowerment. Today, women empowerment is an economic thing to do. Not only it's a human rights thing to do, but it's also an economic thing to do, which will help us really achieve the economic values that we need to have. So from that aspect, that's the work we've been doing. And so in 2015, when I was invited to speak at the UN on behalf of women, my mission was to make sure that we were really looking at this seriously, and this was in June, and then in September this was ratified. So 175 nations accepted this, and it has become the GPS of humanity for the next 15 years, 5 of which have already gone, 10 more to go. Now we have COVID in between, but that's another thing. Like we've had different kinds of pandemics everywhere in the world. So we'll be able to hopefully to mitigate the risk and continue on doing that. My work with that locally as well as globally is to be an advocate. And it is also to make sure that we have an awareness component of what it means, because there are about 17 goals are different challenges. And it's like a menu. You go to a restaurant. Unfortunately, these days we cannot go and see any restaurant, but it's it's a menu where you could choose what do you want to do. So I take this big menu of 17 goals to elementary school, middle school, and even some colleges sometimes. And what I do is I tell them, okay, here are the different kinds of challenges that the world has. Now, if I am in the in any school, I tell them, okay, what would you like to do to really alleviate this challenge? And so you get to listen to so many of these young people that say, okay, I'd like to be, my last one that I had locally with an 8th grader was, I would like to be in landscaping. And I said, why do you want to be in landscaping? He said, well, my parents are in landscaping. Okay, so then what do you see yourself doing 10 years from now? Because by now he's only 12 years old. And I told him 10 years from now you will be 22. In 22 years, he said, I'll own a company that will have sustainable products still in the landscaping space. This is a young man, a 12-year-old that's saying, okay, so then this man, I'm hoping and praying that he will move towards that kind of thinking and that kind of work. Some of our girls, they talk about, I'd like to be an engineer in the an environmental engineer. And there's so much to be done in that space. So I point out that, so you're doing that, so that would be goal 7, goal 13, goal 12. So now they have mapping their lives towards something that is important and relevant, not only for themselves, but it's a roadmap for them to think, okay, you know what, I might be doing that. So that's the kind of work that we've been working on.
And that makes a lot of sense. I think what you've illustrated is a great way to see the problems, but then hone in on what speaks to you most, and then making a large problem small and seeing how you can attack that locally, which I think a lot of times people get stuck in the awareness phase where they just see all the problems and say, oh, this is bad. I'm informed, I recognize it's bad, but there's kind of almost this paralysis. But I think the menu approach is a great metaphor and a very key takeaway on how to proceed.
Yeah.
And so how did the creation of the Pearl Institute occur with your GPS in mind?
So I worked for corporate America for several years, for many years actually, and so one of them obviously was IBM and then Credit Suisse. My work at IBM was more extensive, and so the work that I was doing was related to corporate social responsibility. And so in 2008, they decided to send about 100 global teams, selecting them out of 5,000 applicants. I was selected. I was the first 100, and so they told us, go for a 6-month assignment into, obviously they had partners in Africa. The countries that I went to was Tanzania, city of Arusha, and then Ethiopia as well. So, and that was obviously to do some consulting work with nonprofits to help them tackle some of the challenges that they had. For me at the time, I was in the area of human capital development, so I was asked to work on creating some kind of manuals and books for some of the organizations that we had partnered with. And so, but this was my return back to Africa after so many years, and I had not been since I left. And so it was such an empowering moment for me to see exactly how I left and how I came back as an educated woman and giving back. And so one of the side projects that I took with me was, because my background was in IT, I decided to take a STEM, science, technology, engineering, and math project, where all my colleagues from across the globe, we were 15 of us, we decided to go and work at a school. And when I saw the difference of what it meant, that they knew how to create circuits, they knew how to do all these different kinds of projects that we brought with us, I said, okay, this is the way to really make a difference. And so that was the catalyst for me to think about coming back home and deciding that I wanted to have a nonprofit that was necessarily looking into STEM, and we definitely focus on the science component because that's where the living wages are, specifically for girls. And then we added the A into it because the STEAM, the arts is where the creativity that is tied to connect to innovation and technology. So having those two, important component of the learning would definitely bridge the gap that obviously will make life better for many of our communities locally and globally.
Yeah, and I really liked how you went from STEM to STEAM because, like you said, it takes creativity and the other side of your brain to imagine big solutions for different problems facing us in this world. And how did you transition from private sector to nonprofit? How did you decide, okay, this is the time I've learned enough, I'm ready to go on this journey on my own path?
It was not hard for me because here's the thing. I think in the way that I am, I've always looked at this is the nonprofit space was also on my lap, on my plate because the work that I was doing with IBM last component was to be in the corporate social responsibility, where I was on the giving side. When people asked for grant monies and resources, we were the one I was one of the managers locally, a site that is one of the largest sites here, about 10,000 employees at the time. We were the ones that we were making the grants for the different kinds of requests and asks that they were aligned with our business. And many of them were obviously more into, because IBM was more about technology and innovation company, many of the requests obviously were related to STEM pillars. So moving from, because I knew the giving side, I wanted to be the asking part where I knew once I have an alignment with companies like IBM or Credit Suisse or, Apple, which we do have some work with, and other organizations locally, including NC State, I definitely believe in a strong private-public partnership. So we do work with that, and the transition was not hard. In fact, it was easy because by that time I had an opportunity to know as many people as I needed to know. When I left IBM, I knew the many people that were giving, so it was not hard for me to knock on their doors and say, hey, we're doing this. Can you support us? And it doesn't have to be money. It could be volunteer opportunities. It could be also, resources. It could be some taskis that you want to give away for our students. So from that aspect, I think I was lucky. And I always told my girls, if you don't ASK, you don't GET. So I didn't have any problem asking people, and if they don't give me, then I give them alternative explanation, and if they do, then I'm grateful, and I continue on showing them what we've done with their support.
Great. So it seemed like a natural progression.
Yes.
You have a lot of great things. You might have to write, a small book or something. We can't let you off the hook. How did the recognition for the Presidential Volunteer Gold Awards come about?
So my story on that one is I grew up in Eritrea, Asmara specifically, and my dad, Grazmasium Maasho, instilled in all my siblings and I the importance of being a servant leader. So for that, I remember at the age of 9, myself 9, maybe 11, my sister and I, 9, maybe around 9, 11 years old, every Saturday morning he used to take us to volunteer at the Women's and Child Center. And so this was a long time ago for sure. And I have good memories because it was, they used to, I think America or somebody else used to donate some milk, powdered milk, and my sister and I and many other probably mothers or children were also there. They were helping to mix the milk, and our role was to take the milk out of the bucket, put it on a ladle, and then pour it into the kids' cups. And we did this for close to about 1 to 2 hours, and it was very early in the morning, and that's what I remember. And so service for me and my family and my daughters as well, I have 2 daughters, has been part of my DNA. And to this day, both of us enjoy community engagement. We do believe that making a difference by being a difference is the most important thing a human being can have. It's a purposeful living. And so we volunteer at Habitat for Humanity, women's centers, UN, whatever. And because service keeps on energizing my soul, and receiving such a prestigious recognition from both presidents, Obama and Bush, was just an amazing, it's an honor. It's a true honor that you feel like I still have the letter that's signed by President Obama, same with Mr. Bush, and those pins that make you feel, okay, I'm going to wear them proudly. But that's how Presidential Volunteer Award comes from the government, from the White House, for serving as many. There are certain thresholds that you have to have, a certain number of hours, different kind of nonprofits, and so that's documented in one of their space. And IBM, we used to have that as well. So those were the 2 ones that I received, and I encourage people to continue to volunteer, because volunteering is really at the heart of all humanity. I think the kindness that we're seeing right now across the streets, America is hungry. You see what's happening. The kindness that many of the people that are wearing masks, many of the masks are made by so many people. So volunteering and being kind and generous is one of the biggest tenets of humanity, and I'm proud that I was part of that, and grateful to the people that recognize that. But I don't need that recognition. We just have to do because we need to do. The world needs us.
That's beautiful, especially getting that servant leader mindset from your father at such a young age and setting that example for you and your family.
Yeah. Yes. Thank you. Yeah.
Of course.
Yeah.
And so, how do you define success? You've achieved a lot, but how do you continue to challenge yourself? How do you appreciate the work you've done? How do you process that while continuing to work towards your goals?
So for me, it's you're talking about success, right? Is that what you said? Okay. So I definitely define success as living my true purpose and having a positive impact on the lives of people that are around me, and could be people that I don't know, people that I know. But I also like to make sure that that's an inspiring story for not only for me, but the next generation. It's about legacy. Success is about having an opportunity to do something good, not because you're going to get back good, but because you have to do it. That's the only way that a human being can sustain himself or herself to really do good. Sara and all her colleagues and the many healthcare professionals that we hear, and I only call Sara now because that's the one that I just had recently to talk to, but the many people that I see, they're going into the front line. Nobody goes into a minefield to do what they're supposed to be doing, especially the way that they have not been equipped enough. We have lots of family members that are also in the field and so doing that. So success for me is living a true purpose, a purposeful living. I think Rick Warren is one of my favorite books that he writes about purposeful living, and it has so many examples of what it means for you, that you are in this world for a reason. You are not an accident, and because of that, there is something to do. And that's why I say it is important for us to know that this moment in time must be a reason why we're still alive, to do what we're supposed to be doing. We can't give up now. There's so much to be offering to ourselves, to our family, to our community, to our nation, to our planet. And so that's how I would definitely believe that success is defined from having a purpose in life.
That's good. So it's about legacy and leaving the world a better place.
Yes.
And so for this moment of uncertainty, especially for a lot of the younger generation, I guess what message would you want? You said a lot of great things, but what message would you want to say specifically to them?
So a couple of things, actually. One is that the new normal will need new habits, right? And so, and this, we have to have an understanding that this is not permanent for sure. I think in Tigrinya you say kullu yahalfiyu, kullu halafayu, in Amharic yalfal. And so, and it also, we have to understand also that this is not personal, meaning this kind of adversity is an equal opportunity, indiscriminately inflicting pain to all of us, whether it's a physical pain, whether it's financial pain, any kind of pain. So understanding those two things is important for us so that we could move forward, so that we could pass the pain of the present. So I encourage us to try to find moments of joy, because that's important. You know, again, as I heard many people say, I'm connected with my family. That's great. That's fantastic. I'm connected with people that really matter. And then also giving ourselves a break when we don't measure up to our expectation is very important, because we seem to be hard on ourselves. Oh, shoot, I didn't get to do this. Oh, shoot, I didn't get to finish that. Oh, my God, it just came down just before I could buy that house, that whatever. It's going to come back. So practicing some kind of self-compassion, giving yourself grace. And if there are times that you're feeling sad, yeah, you can feel sad, but then you have to move on. We have to move on. There's no way we're going to stand in this place and feel the way that the world is feeling. And don't get me wrong, I'm not trying to really be all rosy, because there are lots of challenges even within our own confine here and in my own family. But I think it's in the words of Sheryl Sandberg of Facebook. She says you have to keep on leaning in. Who do you lean in against? Who are the most important people in your life? Is it your significant other? Is it your mom, your dad, your child, whoever? And so knowing those kinds of things are going to be important. Knowing that our kindness is light. And the more we extend it, the brighter it becomes, and the more darkness we will illuminate. Every day at 7 o'clock, Delina, my daughter in New York, tells me that they're banging, they're clapping for all the service people. Similar to Lul, my sister that lives in London, she tells me the same thing. They are even banging dishes and things like that. So that kind of kindness, that kind of light illuminates the world. And so final couple of things that I'd like to say is that if I had come to this meeting and they tell me, have you taken a couple of things with you, I would say this. One, I want us to create a gratitude jar. And a jar, I don't mean it doesn't have to be any specific jar. It could be just anything really that holds some information for you to. So with that gratitude jar could be a box of your Nike shoes, or for some women, Jimmy Choo or whatever boxes. Take that out, cut it out, and say, this is what I'll have my gratitude box. You know, you would be surprised that, and then write down any small things that you see that make you happy. It could be the sky that is blue. It could be your husband or your significant other has cooked for you. It could be that somebody said you are amazing. It could be that you sent a card to people that need it. Phone calls you made to people that have not heard from you. Little things that matter. And filling it with moments of joy, and then revisit it at the end of the week and say, hey, I think I've done, this is one of the ones that I felt the most happy. So that's a gratitude jar for you. We're doing that actually in our family. We have a once a week Zoom family call, and we started it. And so I'm finding that I'm writing up quite a few things in it, and it makes my heart warm. That's the one thing. The second thing that I'd like for us to do is try to disconnect a few hours a day from all electronic devices. And you know what? I need to confess, I don't do that myself, but I'm starting. I'm starting this one. So let's try and do that, only because when you are disconnected, I think it's the time where you are more productive. Because you're not really taken away by all the various distractions. It could be, and these days, obviously, many people are calling us for different kinds of reasons to join them for this call, that call, and everything. But it's okay to say, I can't join this one because I know I've got something important to me that I need to do, and it's essential. So I'm going to try that one, and I'm sure my husband will be very, very happy that if I'm going to move it even to a 1 day a week out, no phones, no nothing. And so if we could try and do that. The third one is to breathe. Breathing connects us with our inner strength, and I think if we do that, and I have been taking some breathing classes, and I'm really finding that to be quite important because it helps me to sleep. It helps me to really engage with my humanity as well. And Alicia Keys, just a few days ago, she sang a song that says you're doing a good job. Mm-hmm. And so I would like us to listen to songs like that really energize you, because it's important. Whatever energizes you, it could be Tigrinya song, Amharic song, whatever kind of songs that make you really your day different, fill you up with something. That's what I would say I would continue on working on.
That's great. That's funny because I found myself doing a few of those things, especially listening to positive music, mm-hmm. Whether that's like oldies and stuff that remind me of, growing up listening to music with my parents. And even the gratitude chart, I started doing that a couple of years ago, but just like a journal, 5 items every day in the morning because of some personal stuff. And since then, it's become a routine of my habit, and it just makes you stop and see the world mm-hmm. and appreciate little things. That's been a huge help. You said a lot of great things from saying, the new normal we're in requires a new habit, which is such a key and significant point. And our kindness is our light. And the more mm-hmm. we use it, the more we can shine out the darkness. And that's incredibly, I think, powerful words to live by.
Yes. Thank you. One last thing I forgot to say is that we have children at home these days. Mm-hmm. And I don't have small ones, but I do hear from many parents that are teaching their kids. And it's been a challenge because we've never been a teacher. We don't have the same capacity as a teacher has. Mentally, physically, for some of us might be easy. So I want us to know that it's okay for them not to be so tight on the kids, because teachers are waiting for them on the other side at some point. The kids need to have also the calm and collectness that comes from you as a parent, mm-hmm. whether you are a single parent or not, or, mom and dad at home. It is important for the children to express their the disruption that has happened to them and understand that. And a couple of things that children do, obviously, is also making sure that kids are experiencing something outside of being in a classroom. Could be going out if it's possible to go out for a walk, obviously, in many, or just go outside in the backyard and do something, or do something that is so different from what it used to be in class, because they're also stressed. And so it's important to take this bunch of kids back into school maybe sometime next fall, with being human and whole and not stressed out because of the various stressors that are happening at home, including from job losses, financial issues, and any other things that could happen because of the situation. So please remind our listeners that is an important thing. Give your kids grace and yourself grace, that you are not many of us are cut out to be teachers, and it's okay for you to be a parent that can enjoy children do so many things. Listen to some stories like Kindness 101 from CBS News, for example. There's an amazing, every Monday at 10:30, that kind of story. It helps not only the young ones but all adults. So just wanted to test that before I let you do what you need to do.
That's perfect. And that's the key point, is allowing ourselves grace, but not only ourselves, but children, because they're very sensitive and they pick up on things. They may not verbalize it, but they do sense it and they can feel the tension. Mm-hmm. Thank you. And so now we want to take it to a question and answer forum, and there's a couple items we didn't get to that I'd like to discuss with you and Sara. And Sara, when you were working in the hospitals, did you ever come into contact with any individuals with COVID?
Actually, when I was in the hospital, there were suspected cases on my team of patients having COVID, because as many people have learned, COVID kind of presents like a pneumonia, and the pneumonia is quite prevalent in the winter months, whether it be caused by a virus or bacteria. So there were a lot of suspicions, not only in the main hospital, but also in the veterans hospital that is affiliated with our academic institution. So I know now our hospital has dedicated certain floors for COVID because, again, they are still managing other healthcare cases. But I just also want to thank Tsegga for all her great words, and also she mentioned something about, like, you can either be in a fear zone, a learning zone, and a growth zone. And what we've seen in society is that when this all started, a lot of us were in that fear zone, that panic, people rushing to stores to buy toilet paper, not knowing what to believe. And I think it's so easy to get caught up in that fear zone because we are getting flooded with information. So I think it's important that you be cognizant about what information you are taking in and how much of it you are taking in throughout the day, especially during this time where we have a lot of time to ourselves, into our screens, into the internet and TVs and all that stuff. But like Tsegga was mentioning, this is our new normal requires new habits. And whether that's, like, for myself, I limit myself to only 1 hour a day in the morning of reading news articles about COVID, and that's it. Otherwise, I get inundated with so much information. Whether you're doing more breathing and meditation, that is something I do to help with my studying and to maintain focus. All these things are great, again, because there's a reason we're here. There's a reason we're surviving. And we, again, like she said, must fulfill our purpose, and we got to keep going, but also protecting what we take in and protecting our own peace amongst the chaos that is occurring. But again, there is light at the end of the tunnel, so I just wanted to reiterate her great points.
Oh, that's great. It seems like you've naturally kind of adopted new habits to cope with, the current issues facing us.
Yeah, fortunately, you have to adjust, because it's easy to, for some people, there is an adjustment period and during this time because it is a harsh reality, a harsh change, quick, abrupt. A lot of things are changing. However, everything is a choice. You can choose to stop, or you can choose to take on the challenge and see how can I adapt to this. For me, I'm looking at this time as like, okay, this is kind of a time for me to pause and reflect what I want to do with my future, a time to catch up with my family, a time to catch up with friends. Of course, there are challenges every day, but of course, you tackle them head on, and you grow from them. So
yeah, that's great. You turn this into to look up and see the opportunities available and how to reflect and better yourself. I just want to give a reminder for any individuals who have questions to please state your name when you ask your questions, and don't forget to hit *6 to mute yourself.
Hey, my question is for Tsegga. What's her advice for someone who speaks a second language to improve, to be a public speaker, and as well as somebody who has a non-profit organization, mainly for women, how to establish it? It's kind of it's very hard to get it going. So just a couple of questions.
Okay, thank you. Your name? I'm sorry, I forgot. I couldn't remember the name.
This is Nuria.
Nuria. Okay, thank you.
Yeah.
So Nuria, thank you for your question. So nonprofit are very easy to set up. It's not really hard. It's obviously one of the most important things is so long as you have what you want to have. This is exactly the time that I was saying we need to start reinventing ourselves, maybe uncover the reasons why you want to do what you want to do. And so in North Carolina, it's not expensive. The forms if they are not one of those huge companies, they're going to be asking for millions, which your budget is not anything over $50,000. There's a very simple one form that you just write it up, and then less than $200 application fee. It doesn't even take that long to set it up, and making sure that you have the right design for whatever outcomes you're trying to, solutions you're trying to provide for the challenge that you're trying to solve. And so that is not a hard thing. Public speaking is obviously a place where women, specifically Habesha women, sometimes I would say, because we come from a very different upbringing, maybe we have that fear. But I have seen people even from other nations that do have that same kind of fear of speaking. So it's something any one of us can conquer, and it's not hard. So long you have what your message seems to resonate with whom you are. It's a matter of repetition. It's a matter of really believing in what you're saying, and it's easy. And there are lots of courses from other nonprofit organizations that could teach you to do that, to even coaches that help you to be part of that. There's small business administration offices across our state, for example. The community colleges have different kinds of offices and places. There's a women's center in the Raleigh, North Carolina area. NCIMED is another organization that does that. So if you want to connect back, and if there's any way that I could share that information, I'll be more than happy to do that. And you can get my information through either the Pearl Leadership Institute, or you can just connect with me by via LinkedIn. And so I'll be more than happy to share any information that I know, or connect you with people that I do know that will be able to help you to move that for you.
Hi. My name is Medhin, and I am currently a first-year college student. I have found that reading books around self-growth or inspirational books have actually helped me to cope with what's happening now and feel productive despite being stuck in the house. And Tsegga, mentioned a couple of books that she recommends. I was wondering if there are any more books that you guys suggest that people read during this time.
Sara, go ahead. I think you might have some, and I have some as well.
I don't have any inspirational books because I'm currently reading about medical stuff at the moment. But trying to prepare for my application and stuff. But when I have more free time, yes.
Okay. So for me, Marawi, thank you very much, and keep up the good work. I'm proud of you. School is good. So Lean In by Sheryl Sandberg, that's the one that I'd like you to look into. The other book that I like is called Mindfulness by Mark Williams and Danny Penham. And then another book, and I do work with the organization's Kick Some Glass. It is by two women that I have worked with, Jennifer Martineau and Portia Mount. And the last one that I'd like you to look into, very, very powerful, is the Expect to Win by Carla Harris.
So you said Lean In, Mindfulness, Kick Some Grass, and Expect to Win.
Yeah.
Do we have any additional callers?
How about you? Do you have anything you want to share?
Hello?
Yes.
Hi, I have a question. My name is Winta, and I was just wondering for either Sara or Tsegga, do you think the experience of this global adverse event will spur and motivate the millennial generation into a period of collective creativity and growth?
Well.
Yes,
Sara,
I do.
Go ahead.
Sara, go ahead. I think you are more of a millennial than I am anyway, so.
But I feel like you have more knowledge and wisdom than I do.
No, I think it's good to share your experience. Thank you, yes.
Yeah, Winta, thank you. A great question. I definitely do. I know there's a lot of, within, I could say from the healthcare perspective, I'm seeing a lot of myself and my classmates kind of use this pandemic as a time to kind of reflect and think about what the future of our society and healthcare specifically is going to look like. How are we going to navigate social interactions? How are you going to ensure that people are learning in the most effective environments? How are you going to ensure that people are truly connecting with one another? I think all this time is also illustrating the power of technology in terms of connection. With all this time, I've heard a lot of stories of people being able to connect with family and friends. So I definitely think there's going to be, especially within our generation, profound change in how we not only interact, but also our health, the framework of our healthcare society, even our political society, economic. All those things are definitely going to be changing. It's going to be exciting to watch and be a part of, definitely.
I definitely believe the same way as well. I think I back what you just said, Sarah, because one of the things that I worked my last assignment with Credit Suisse, I was working with workforce development. And so one of the biggest things that they were looking for is belonging. Belonging is the new diversity. So belonging in many companies these days, it means that you want to be with a company that's not only is socially responsible, but it has some purpose. It's not going to be only satisfying your shareholders of the various pennies and dollars and whatnot that they're looking for at the end of every quarter, but it's going to be about employees that are very much intricately involved with a lot of emotional intelligence that managers need to do and understand what their employees are all about. It's not going to be about fighting towards reinventing themselves so that they could beat AI and all that stuff. It is going to be about the human connection that they need. So there's going to be a shared responsibility. I'd be very curious to see what this is going to bring and how much of a strategic move they're going to be making, companies, organizations are going to be making towards not only attracting but also retaining employees. And so, believe me, it's going to be a major responsibility that they have, because one of the things that I did before I came to this call, for example, I was looking at how are companies advertising right now? What are their ads? So here's a couple of things that I looked at. IBM said, put smart to work. Who smart are they talking about? They need smart and talented people like all of you on this call. Not only smart and talented, but also caring and people that are going to be aligned with their being. So J.P. Morgan, for example, it says a steady hand in unsettled times. What does that mean? How steady are you to help them become the next biggest J.P. Morgan that they want to be so that they could be their competition? SAS, which is one company locally here that I do know has an amazing track record of retaining employees. It says take an in-depth course on your own time. What does that mean? And so when you look at different kinds of areas, what are they saying? So if they're saying this, how can I be aligned with their thing? Harvard, which is one of my schools right now, it says a cutting-edge curriculum for future leaders. Why is that important? They need leaders that are conscious. They need leaders that are consequential, not the ones that we are seeing across the globe that are doing whatever they want to do. This is not going to be a walk in the park anymore. Every young person, every millennial right now is woke enough that they're going to be really demanding the things that they're going to be demanding. And it's going to be a time where organizations will have to really work with them so that they could they could find to be a better version of themselves and have a continuum for their own growth and opportunities to go ahead.
Thank you.
Hello. Okay, my name is Iyasu Habtadavar. I'm a physician, a retired physician in Michigan. My question is probably been answered, but just to put it in a different way, does the effect of COVID-19 on the achievement or hope of the 2030 sustainable goals? Now, the way I'm putting it is, could this be taken in a positive way too? This may make actually change strategies or facilitate some strategies to achieve the sustainable goals for 2030.
Is that geared towards me?
Okay.
Yeah? Let's see.
Yes.
Okay. So the strategy for the 2030s, obviously, to be, we definitely think that this is the decade of action. And I'm sure, like anything else, because of this time that we are in, whatever the targets and achievements that they were placed will definitely have some issues to be attained. Yet again, it's one way for us to say, how do we go and move forward? And the only way we can move forward is by having young people, the millennials, to really become the people that are going to be making the difference by being the difference. Will they be achieved? I hope so. Will we be doing, all of us, the right thing to make sure that we eradicate poverty? It's in the interest of all nations. It's in the interest of humanity that we don't see anybody go poor. It's in the interest of humanity that we have clean water. It's in the interest of humanity that we have safe cities. It's in the interest of all of us that we don't have wars and refugees, peace, and adjustment to what we need to do. So this being the 17 goals being a GPS for humanity, yes, they might have some hiccups, but nonetheless a hiccups that we hope that we will all have hands on deck to make sure that that is possible and doable.
Exactly. I have a question. Yeah, and I'd like to address you guys. I have a question as well. Just for action items and takeaways, I mean, we've said a lot about lessons and values, but I mean, even though we're all impacted at varying levels by COVID, from most privileged to those disenfranchised, what are 3 things we can do to prioritize and play our part to achieve global community engagement and service leadership?
Sarah, for you or for me?
Both of you can be great from your different perspectives.
All right. So for me, it's about hope and gratitude are going to be the biggest catalyst to hold on to. Because we have to experience positive vibes and work towards our goal. Life is almost like, I know we have a lot of difficulties and challenges right now, especially in our communities. We've been impacted probably more so than anybody else at this time for the various reasons that are probably there. But when we hold on tight to hope and to gratitude, and again, like Sarah said, faith is important. I do believe that part of the this too shall pass, understanding that this is not a permanent thing and it's not also a personal thing. It's going to be like, what do they say? It's like a day-to-day living for now, but it's important not to sit down and think about what's going to happen to me tomorrow. I have one of my sisters, for example, right now. She's studying Spanish. It might sound frivolous, but you never know what that will take her. She probably will be working with some communities that will speak Spanish. So reinventing yourself is going to be one of the biggest take that we have to do in this moment. Because here's what I know is that there's no perspective. Nobody has any prior about this. Nobody has any counterfactual about this. Nobody has experienced any like this, at least the ones that I know. And so but we have a lot of information, a lot of uncertainty, a lot of volatility, and ambiguity. And for that, what is it? You have to be a leader in action. Self-leadership is going to be very important, to get up in the morning and do whatever you're supposed to be doing. Because this thing could take us down to the level that we would say, okay, I'm going to sleep today. I'm not doing anything. We can't do that. We have children. We have family. We have opportunities. And so understanding that is probably going to be one of our biggest light that needs to come out of this. Sarah maybe wants to add more.
Munir, I'm sorry, can you repeat the question? You said
Sure. So 3 things we can do just from no matter where our privilege is, and things we can prioritize to achieve more engagement and proactive service leadership.
Definitely. Okay. Well, you actually provided a great resource at the beginning of this talk called whileathome.org, which is a wonderful platform that provides so much information for people to donate or get involved, because one thing to remember is that a lot of us are so privileged to have a roof over our heads, to have food in the fridge, to have a car to transport to the grocery store during these times, but a lot of people don't have these basic necessities. A lot of people in shelters don't have access to food, and I know a lot of medical students are also volunteering at shelters, and they're expressing like people at these homes are developing a lot of mental health issues in terms of anxiety and not knowing what's going on. However, having volunteers there has helped them. If, of course, want to maintain social distancing, if you don't feel comfortable with that, a lot of places would need to donate blood, of course you can have monetary donations. So there's a lot of things you can do from the comfort of your home to assist people during this time, and that website is definitely great. And Adam made a great point. This is a time of reflection. Yes, you have to be gentle with yourself because every day we don't know what's going on. Everything's a challenge. Every day can be a challenge. However, this is an opportunity to also reflect and think about your future and your legacy and the impact you want to make, especially as myself as a millennial, moving forward, going from this, because we're all going to be changed coming out of this pandemic. Definitely. So, yeah.
Hello? That's great.
Can you guys hear me?
Yes, go ahead.
Salam. I was just quietly listening to you guys. I really appreciate you, Sara, Tsegga, and Munir, for the experiences and all the talk you had. I appreciate you guys. Just want to add on that. I work in a VA hospital, and this COVID brought a lot of attention and a relationship with others and patients. People are so helpful. We got all the local people coming with food, snacks, drinks, and they asked the different hospitals what they can do. I think this really brought a lot of unity, even if in a bad way, but people are really start helping in as far as the leadership also. We have different departments, and people start taking over different projects and asking to help and train themselves. Even in a hospital, most of the surgeries are closed, so they go to emergency room or the primary care. And even I'm in the COVID team, screening and testing, so they come and help us every day. They just want to they come and ask and see what we need. So this brought us a lot of differences and attachments and helpful. So even the millennium, I know we're not taking students anymore. We have a lot of medical students, NPA, and nurse practitioners, but on the outside, they're really helping the elderly, volunteering with shopping and dropping, stuff like that. And I think time will change. I know this is really a dark moment, but when we get over this one, a lot of things will change globally, not only here, but globally. And as far as the earlier question also, like Tsegga said, the 2013 agenda is commitment to eradicate poverty and also globally. So they're working on not only on this, but different like malaria, HIV. That was the whole goal. I think it will continue, and we'll have a good global vision on that. So just want to add up.
Yes. Thank you very much for sharing that. Do we have any more questions?
Munir, one of the things that we did not touch on, and that seems to be an issue, especially in our society overall. I don't mean here in the Habesha community. I think there is also an increased violence. Intimate partner violence has been the most common form of violence in every community. And it's understandable in many ways now that because of the situation that we are all in. So we know these kinds of issues are there, but I think it's important to also address it in the way that needs to be addressed. I am not obviously in any way capable of making any statement about that, but acknowledging that it's there, acknowledging that there is a need for us to give grace to each other. We are all in one space together. The communication has to be different, has to be tamed. Somehow from my perspective, from my angle, nothing clinical, nothing psychological that because I'm not qualified to make any statement like that, but it has been suggested that many of these moments have been really hard, not only for the adults, but also for the children. So I am concerned about the traumatic experience our children, the next generation of leaders, emerging leaders, as I call them. It's important that they have a life that does not have to be as stressed as ours is. So for any adult person that is on this call, please be aware that it is an issue that has been viewed from a very traumatic space, and it's not going to be, we don't want to add more to what this challenge has given us to add that kind of personal trauma, especially for the young ones.
Mm-hmm.
Yeah.
Thank you for making that note. I think.
Yeah, I just wanted to add on. I'm sorry, Munir.
Of course, go ahead.
I just wanted to add on. Thank you for bringing up that point, because I think it needs to be definitely noted. And also, analogous to that is that this time can also be hard for people with mental health issues, those suffering from anxiety, depression, eating disorders, a wide spectrum. All this time alone, whether they be alone in their home, can be very difficult, and it's just making sure that you provide grace to those and that you know may be suffering, and those who are suffering, make sure you can reach out to those you feel comfortable with. I know a lot of therapists are offering telemedicine sessions. If you are connected with a therapist, reach out. Even establishing routines, there's been studies to show that routine does help with mood, in that sense, like waking up in the morning, making sure you spend at least 30 minutes a day walking outside. These little things do have a positive impact on your mental health. And I'm grateful to come from a generation where I feel like these mental health issues are being brought up more and being validated. But I think it's also important to keep in mind that this time can be difficult for those with mental health conditions. So just to be cognizant of that and to move with grace during this time.
Yeah, that's well said by both of you. And I think one of the key points as we conclude is to have grace, right, for yourself and for others, and how we deal with one another. And to remember that a lot of times you may be inundated with all this negativity. A lot of ways to get out of that is to be outside of yourself, and that's whether that's giving back to your community, reaching out to loved ones, checking in on people if you have the capacity to do so. And so I want to thank Sara for sharing all her experiences, and that those of her colleagues on the front lines and providing that experience and that viewpoint of how this is affecting her in her school. And Tsegga, thank you very much for sharing your experience on the nonprofits you've built and all your future successes. And thank you both for everything that all you've done and your time today. We truly appreciate it, myself included.
Thank you. Thank you for hosting us. Thank you for giving us this platform. And it was a good thing. I just want us to know that when we pass through this challenging time, on the other side of it, we will look back and realize that we were part of an epic time in history where caring triumphed over fear and goodness prevailed. So I thank you all for being part of this conversation. And I thank you again, Dr. Munir, for giving us this platform, and Munir for hosting it.
Of course. Thank you both. Yep. And this concludes our teleconference.